There's a world that most therapists have not quite recognized. While when the patient comes to us, patients, they're suffering. They could be angry and enraged or devastated or feeling worthless or loss of self-esteem, anxiety, panic attacks, or addiction to overeating, to drinking. And on one hand, they want to change. And so the schools of therapy have developed fabulous techniques with creative names in our field about how to help people, and you've got all these different approaches, and most of them have considerable merit. But what they're not taking into account is there a side of the patient that maybe doesn't want to change, and do we need to look at that before we jump in with all these wonderful tools that have been created? And to give a really simple example of it, to think about relationship problems and relationship conflict. And I remember when I first began to try to learn about relationship problems, I must have bought 30 textbooks on marital and couples therapy, and I would go to workshops of big name people and helping couples change, or whatever the topic was, and I started noticing that these techniques sounded wonderful, but when I would teach them to troubled couples, they would kind of work in the office, and then they'd go home and bash each other's brains out and not do any of their homework, and they would come back the next week, fighting and just as intense as ever. And I began to ask myself, are we overlooking something here in our assumption that people with troubled relationships want loving ones, and that all we have to do is put the tools in their hands to develop loving relationships? And in my workshops, I do a little thought exercise that makes this point very dramatically in terms of what I call outcome resistance and process resistance. Maybe the people who are watching right now could do this exercise. I say, can you think of one person who you don't like or get along with now or at any time in your life? Just someone you resent, and they're self-centered, they're exploitative. They always have to be right. They're demanding whatever the issue is. So all the hands go up. And then I say, now let's imagine that you had a magic button on the desk right in front of you. And if you press that magic button right now, that person who you so deeply resent will instantly become your best friend in the whole world. How many of you are going to press that magic button? And maybe if you've got a group of 200 people, you'll see 3 hands go up.
Uh-huh.
And then I say, that's what I call outcome resistance. I just gave you the choice between an abusive, hostile relationship, hateful, miserable relationship, and a joyous, loving one. And what did you choose? And then they see the point. Yeah, they're not wanting a loving relationship. And there can be all kinds of good reasons for that. Maybe the person isn't worth the investment of your time and effort, but that would be an obvious example of outcome resistance. And if you don't take that into account in your work with people with troubled relationships, you're going to be throwing all these wonderful tools at them, and they're just going to be resisting or saying it won't work, or why should I have to do all the work, or some such thing. Then there's a concept of process resistance. See, outcome resistance for depression, for anxiety, for whatever the target is the concept of a magic button. Press the magic button and you'll be cured. And then, say, a depressed patient will say, well, sure, I press that magic button. And then you could say, but I can see a lot of reasons why you might not want to do that. And then you bring to conscious awareness the resistance in a kindly way.